A hearing impairment is similar to deafness, but it is not the same. The official definition of a hearing impairment by IDEA is an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance but is not included under the definition of deafness. Hearing loss above 90 decibels is generally considered deafness, which means that hearing loss below 90 decibels is classified as a hearing impairment. A hearing impairment is a general term that covers several different types of hearing loss and disorder. The most common are conductive and sensory neural hearing losses, but others include auditory neuropathy spectrum disorder, mixed hearing loss, central hearing loss, and auditory processing disorder. These disorders are characterized by problems or damage to a part of the ear or disorganization or damage to the brain. There are 4 different categories for the cause of hearing loss: genetic or hereditary factors, infection, developmental abnormalities, or environmental or traumatic events. When hearing loss occurred can be described in a number of different ways. First, it can be congenital, meaning it was present at birth, or have delayed onset, which is sometime later in life. It can also be prelingual or postlingual. This tells us whether it occurred before or after a person learned to read.
Students with hearing impairments face many educational challenges in the classroom. Many of the obstacles they face regard communication. Students may have difficulty with grammar, spelling and vocabulary, taking notes while listening to lectures, participating in classroom discussions, and/or presenting oral reports. Students may fall behind in class, which in turn can have a negative effect on their confidence, and their self-esteem may suffer. Teachers should be sensitive to the social, academic, and emotional challenges that students with hearing impairments face. Teachers need to make special considerations when teaching children with hearing impairments. Some of these may include facing the child during all oral communication, using as much visual information as possible, keep environmental noise to a minimum to keep from interfering with listening devices, and frequently check to make sure that their listening devices are working properly. Teachers may also want to assign the student a desk near the front of the room so that they will be able to convey messages easier. Teachers may have to make a few additional changes in their classroom when they have a student who is hearing impaired. However, they should make sure all their needs are met while also allowing them their independence.